everyone. I'm the Professional Training and Public Engagement Coordinator for the AMR programme at Public Health England. And the aim of my presentation will be to give you an overview of some of the reasons why we should be engaging with the public on AMR, give you an insight into some of the campaigns that have already taken place, some of the resources that are available, and our work with voluntary organisations. So the UK 5-year AMR strategy that was set up between 2013 and 2018 highlights 7 key areas for action. These actions describe how Department of Health, Public Health England and DEFRA coordinate with each other across different sectors to deliver the AMR programme. And as you can see here, number 3 highlights the need to improve professional education, training and public engagement. So, antibiotics. It's been shown that antibiotic resistance is poorly communicated and widely misunderstood by the UK public. The Wellcome Trust undertook a study to gain a deeper insight into people's understanding of antibiotic resistance. A series of interviews and focus groups were conducted in Manchester and Birmingham, with some of the following findings. It's my body that becomes resistant to antibiotics. So there's this thought that it's the body that becomes resistant to antibiotics, as opposed to the bacteria that cause the drug-resistant infections. So the more you take, the more your body becomes resistant to it. Secondly, if my symptoms have gone, I no longer need to take antibiotics. This may explain why some people fail to finish the course, which can be a major factor in the development of drug-resistant infections. It's not my problem. Few of those interviewed thought that they were responsible for overusing or misusing antibiotics, so therefore mistakenly thought that resistance was not a problem for them. Another finding was that people actually have a better understanding when AMR is presented to them in a way that is relatable to them. So people were much more receptive when they were presented with real-life examples of how antibiotic resistance could affect them or their families, with reference to specific bacterial infections that they might have had, such as strep throat or UTIs. Another consistent finding was that people have a positive relationship with antibiotics. Interviews felt that by getting them was validation that they were both ill, both for themselves, and that they hadn't wasted their time or the doctor's time. Every infection prevented means less antibiotics used, which in turn will lead to reduction in antimicrobial resistance. It's about the simple messages that we should be getting out to patients and members of the public. A good time that we can do this is during International Infection Prevention Week, which will take place between October 16th to 22nd, 2016. The theme that has been chosen this year by the Association for Professionals in Infection Control and Epidemiology has set the theme of the chain of infection. The International Scientific Forum on Home Hygiene have developed some engaging resources for members of the public, particularly focusing on home hygiene. And this year, they're developing an e-learning resource that's very accessible as well and should be launched in the next couple of months. So just to give you an overview of the timeline of some of the campaigns that have taken place already. The antibiotic campaign has been running since 1999. And with that, there were a number of leaflets and postcards that were presented in GP surgeries. In February 2008, the campaign featured 3 posters displayed in magazines and newspapers. The key message of this campaign was the best way to treat most colds, coughs and sore throats is plenty of fluids and rest. For advice, talk to a pharmacist or doctor. In 2008, the ECDC coordinated and launched a Europe-wide awareness campaign, the European Antibiotic Awareness Day, which is held, otherwise known as EAD, and is held on the 18th of November every year. This was stimulated by the success of public awareness campaigns in Belgium and France. In 2014, Public Health England developed the Antibiotic Guardian campaign, which was developed in support of EAD. Can I ask here who has signed up to become an antibiotic guardian? That's great to see so many hands. Hopefully by the end of today, you'll all become antibiotic guardians. So I should have said, if you haven't already, my stall is outside, or you can sign up via your phones. In 2015, the WHO led on World Antibiotic Awareness Week, which will take place between the 14th and 20th of November this year, with EAD falling in between that week. So just to give you an overview of the aim of the development of the campaign, EAD was developed in 2014, and the aim was of the Antibiotic Guardian campaign was to develop a campaign that would be available all year round, a campaign that moves from simply awareness raising to engagement, and a campaign that requires a commitment from both health professionals and the public. The campaign was developed by Public Health England in collaboration with all the UK devolved administrations and professional organisations. And there's an EAD planning group with public and third sector representation from both human and animal health sectors across the UK. So the Antibiotic Guardian campaign moves from awareness to engagement, and it calls on everyone to become an antibiotic guardian. It's a behaviour change campaign. And when I put together this slideshow last week, there were 32,412 antibiotic guardians, but now this has moved up, increased by over 150 since last week. If you go onto the Antibiotic Guardian website, there's a very simple video which is put together by a doctor who explains the simple steps that you need to take to become an antibiotic guardian. And the idea really is to select the group that you fall within. So if you're a healthcare professional or leader, members of the public, student or educator, and pick a pledge that you will take and be responsible for. So some examples of pledges for members of the public include: if the NHS offers me a flu vaccination, I pledge to accept. If I'm prescribed antibiotics, I will take them as prescribed and never share them with others. And I will wash my hands after sneezing or coughing to reduce the transmission of infections. They sound simple enough. So Public Health England developed some Antibiotic Guardian and EAD resources to provide individuals and organisations with key resources to engage, educate and encourage others towards positive behaviour change with regards to antibiotic prescribing, expectation and use. In addition, a letter is sent out every year to the NHS, local authorities, universities and professional organisations to also encourage them to sign up to become antibiotic guardians. So this slide here just shows some examples of activities that have taken place, awareness and engagement activities in hospitals, community pharmacies, universities, organisations across the UK. And we've also had a lot of engagement via social media as well, using the hashtag AntibioticGuardian. As of the 30th of November 2014, the week after EAD, 11,833 pledges had been made, so we reached our target of 10,000. 69% of the antibiotic guardians signed up as healthcare professionals, with the remaining 31% signed up as members of the public, which really highlights the need to engage more with the public and raise awareness. We were really surprised to see that pledges had been made from across the world in over 77 countries, and there were 5 or more pledges made from 24 countries, including South Africa, USA, India, Nigeria, Australia, and several countries in Europe. The Primary Care Unit in Public Health England have created an online resource called eBug, and the idea really is to produce a free educational resource that makes learning about infection prevention and treatment and the spread of infection quite fun and accessible for children and young adults. So the website is available for junior and senior students and young adults as well, and it consists of some games and lesson packs, and is now being translated into 22 countries and 22 languages. As mentioned earlier, the public information should reflect a One Health agenda. So for this reason, we have been liaising with a number of veterinary organisations, including the Bella Moss Foundation, BVA, VMD, and NOAA. So just to give you an overview of our public involvement forum, the forum was set up this year, and so far we've had one meeting, and the idea was to engage with the public via voluntary organisations, our strategic partners, Public Health England colleagues and lay members. The first meeting was a success, and we had representation from animal health, respiratory conditions, faith organisations, black and minority ethnic organisations, home hygiene, and a number of health watchers. The idea was to raise the importance of AMR and encourage organisations to engage with the public and their networks on the importance of raising AMR, especially during International Infection Prevention Week and World Antibiotic Awareness Week. The idea now is to use their resources and their expertise to produce a public engagement toolkit to support local public health centres and health protection teams. If you know of any organisations that would be quite interested in getting involved or feeding back any information of public engagement activities on AMR that they have carried out and they'd like to share that, then please do get in touch. My details are at the back of the presentation. So just to give an overview of some other local engagement that's been carried out, Healthwatch Devon arranged a talk at their local science cafe. Microbiologists came and spoke about antibiotic resistance. Also, Devon County Council Public Health launched a campaign called Listen to Your Gut, and they launched quite a funny video on YouTube. I'd recommend watching it if you haven't already. And it's just two tummies talking to each other to help parents care for their children when they have any minor ailments without using antibiotics. So just to give you an overview of some of the work that we're focusing on this year for Antibiotic Guardian, we've been producing resources for 3 groups in particular. So healthcare students, we've been working with university students, looking for Antibiotic Guardian champions. We've developed a junior Antibiotic Guardian as well for children and their families. And for both of these groups, we've been working with Nursing Directorate and also an organisation called Make Waves, and we've been producing virtual badges for uni students and young children to complete some tasks. And once they've done so, they can gain these virtual badges online, which has been quite successful within children. And also universities can put on their LinkedIn accounts. And also the public via community pharmacies. We've been engaging a lot with community pharmacies. So just to conclude then, it's really important that we need to improve professional education, training and public engagement, as it's one of the 7 key areas of the 5-year UK AMR strategy. England has participated in EAD activities since 2008. Awareness was increased, but there was no evidence of increased knowledge and behaviour change. For the first time, using behaviour change strategies, the Antibiotic Guardian campaign has shown evidence of moving from increasing awareness to engagement, and has had commitment from both healthcare professionals and the public. And the evaluation of the Antibiotic Guardian campaign highlighted that it has been effective for both increasing knowledge and changing the behaviour of particularly members of the public. So if you haven't done already, please sign up to become an Antibiotic Guardian on your mobile phones by making a pledge. Thank you.